Myofascial release for low back pain. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. I see a lot of people with back pain because it can often be related to pelvic floor dysfunction. So today I want to show you some simple tips in order to relieve back pain. First, we're going to start with a quick lesson on anatomy, and then I'm going to go right into showing you what you can do at home to help yourself feel better with some simple tools. So let's get started. First, let's cover a little anatomy so that you know why I'm going to show you what I'm going to show you. So I'm going to show you this little diagram here. I do have permission to use this from Pelvic Guru. And what you're looking at basically are some muscles around the lower back and the abdomen. So the muscles that we're going to target in this video to release myofascially are the psoas muscle. So you're going to see that coming from the front here. And I'm going to show you on the little spine model as well. And then we have the quadratus lumborum, which is coming from the back side. So you can kind of see this muscle here from the front and the one from the back. And we're going to target both of those muscles in order to relieve some back pain. Let me grab my spine model here. So if you can imagine, this doesn't show the muscles, but we're going to be putting a small ball, which I'll talk to you about that in just a bit. We're going to put it along the front to target the psoas muscles. Those are part of your hip flexor muscles. So think of them as coming from the front side. They attach onto the front side of your vertebra in your lower back. They come down through this area. They meet up with the iliacus muscle along the inside of this hip bone, and they go into the inner thigh. So if you have back pain, I want you to consider maybe doing some myofascial release to the front side because of the connections and the attachments of the hip flexor muscles. The other muscles that we're going to connect with and release come from the back side, okay, in a little bit higher, but into the back here as they go down into the hip. What you're going to need for this video in order to treat your back pain and do a myofascial release, you can grab a small ball. Basically, I have one here. It's about 4 inches in diameter. It's a very small inflatable ball. So not like a Nerf ball that's going to collapse underneath my weight. It's going to hold its shape, but it's going to give me a soft surface. So if you are dealing with a lot of discomfort or pain, I would recommend stick with something like this. It's a very soft ball to start with. I also have a massage ball here. You can give like a massage tune-up ball or a yoga tune-up ball, excuse me. And you can find even a tennis ball, perhaps. You might even already have at home. This ball here is pretty firm, kind of like even a lacrosse ball, but a tennis ball is going to be firmer than the inflatable ball, but it's going to have a little more give than this ball. So I'm just giving you some variety. And so you're going to grab that. And also, if you want, you can have a yoga mat. Okay, so we're going to get started. So what you're going to do is you're going to want to be down possibly on the floor. Again, if you have a lot of pain, you might want to do this on your bed or even a couch where you have a softer surface and you can allow the ball to really be a little bit softer into that area for you. But I'm going to do this on the floor, and I'm going to use this small inflatable ball versus the firmer one. So what you're going to do here is you're going to come down onto your back, and I would recommend to have your knees bent. That way you can have a little bit of better support for your back. And then I'm going to show you here on my left side, but you're just going to take the ball, you're going to roll a little bit to your right, and you're just going to place it right along your spine on that left side. So I'm up higher than my hip, so I'm not directly on bone, and I'm lower than my rib cage. So somewhere between my hip and my rib cage, and all I'm going to do is now allow my body to come back and to place that weight down over top of the ball. So from there, I can choose to stay right where I'm at with my knees bent, or I can straighten out my legs. So you kind of play around with that at home. But when we do a myofascial release, the key to doing a myofascial release is to actually hold for long enough where those muscles can really relax and respond to the pressure of the ball. So don't get in a hurry with this. I want you to try to hold for a minimum of 3 minutes, just allowing your body to drape over the ball. But ideally, if you can hold for 5 minutes or even a little longer. And when you do this, I really want you to be nice and relaxed and also aware of what you're feeling. So try to do this when you're not distracted, when you're having to pay attention to other things, or watching TV or using your phone, just try to rest here and allow that ball to do its work. I'm going to give you a bonus tip here. You can even use a wall. I find this to be really helpful because when we use the wall, you're going to actually stretch out more into your body and down into your legs. So what I would recommend is just get as close to the wall as you can. And then what you're going to do is just get your legs up onto the wall. And again, I can roll to the side, place that ball where it needs to be. Now I have my legs on the wall and I can lie down with my palms up into a T position with my shoulders. And now what I'm getting is a lot of nice, good lengthening out, not only through my spine, through the top of my head, but also through my legs and my arms. Now, a lot of the people that we treat here at the Healing Spot, they have a lot of other areas that are contributing to back pain. So it's rarely is it just one specific muscle or one specific point that is causing the pain. So this is a really great way to really treat your whole body more holistically. So again, you can do that for 3 to 5 minutes. And I used the small ball, but again, you can use a firmer ball. Just know that's going to get in there a little more aggressively. So the idea is, even with the firmer ball, you want to make sure that you're draping your body over the ball and allowing it to soften and let go. If it feels like it's too much and you're not relaxing, it's not softening, or it's not feeling better over time, then make sure that you switch to a softer ball, okay? You're starting with a ball like this. This is one that we give to all of our new patients. And I tell them they can let out some air here. So that is a way to, if you have an adjustable ball, to make it a little less intense as well. The second part of this myofascial release is going to be for the psoas muscles, or those hip flexor muscles in the front. So with this, you're going to actually lie down onto the floor or onto your bed or couch, and we're going to put the ball in the front side to target those muscles. So I'm going to come down here first to my side, and what you're going to want to do is you're going to want to find your belly button, okay? And you're going to take the ball just to the side of your belly button. So I'm showing you here on my right side. So I've placed the ball there, and then what I'm going to do is lie down. So I place that ball and I keep it in place. And I'm just going to start like in this position because it's going to be a little less aggressive of a stretch or of a release. Now, I will tell you, I'm just to the side of my belly button. You could easily come up a little higher so that you're a little closer to the rib cage, or you can come down even lower into the front crease of your hip. That's all the length of that hip flexor muscle complex. So from here, I would recommend to start like this. And all I'm going to do is kind of shimmy my hips kind of side to side and find, almost like I'm rolling the ball, I'm trying to find maybe a sore area, tightness, pain, okay? And then what I want to do is allow myself to soften over the ball. Now, if this is too intense for you, move the ball slightly so you're finding a spot that's sensitive but not super painful. You are always in control of this release and how much you're pushing yourself. From there, you can come down, and I would recommend to stack your hands and then place your head onto your hands face down. And that way you're not straining into your neck. Now, because I'm doing this video and I'm talking, I don't want to stay face down like that. But that is one way that you can allow your body to really drape over the ball and soften. Again, you want to hold here for 3 to 5 minutes. Now, I showed you that the length of those muscles really are long. And so really going anywhere from your rib cage down to the front of the hip from the front, or the rib cage to the sacrum or your hip in the back. So you might find that you maybe place the ball a little higher, do your 3 to 5 minute release, and then move the ball a little bit lower, do another 3 to 5 minute release. And you can do that all in one kind of session, or you can split it up if you need to. So again, you are in control on finding what feels good for your body and also taking the time to do the releases. One last thing I'll say about a firmer ball is if you're on the floor and you're using a firm ball, it can feel pretty intense in there. I want you to feel kind of a mild to medium release. If it's really intense or your body is kind of screaming at you and saying, hey, I don't like this, I'm not softening, I'm not letting go, you're likely using too firm of a ball, or the floor maybe isn't appropriate for you. So this is what I tell my patients is, You might be able to use a firm ball on a soft surface like your bed, or you might be able to use a soft ball on a firm surface like the floor. And depending on how flexible your muscles already are, you might be able to use a firm ball on the firm floor, but I wouldn't say that everybody is able to start right there. So I hope this release helps you. I also want to finish this video by saying this is one way that may help you to target and release your back pain. However, if this doesn't work for you, it doesn't take away your back pain completely, I wouldn't be surprised. Okay, there's a lot of reasons that you might be having back pain, and it's just one technique that I have to share with you today. There's a lot of other ways that you could be helped with your back pain. So with that said, don't get discouraged if this doesn't help you. If it does help you, please leave a comment below. I would love to celebrate that with you, and also to just encourage other people out there that this can be something that can be very helpful. If you would like to have a little more guidance with your back pain and find out really what's going on, what could be the root cause of it, and what other techniques or tips might be useful for you to help relieve your pain, please reach out to us here at the Healing Spot. Head to our website, healingspotpt.com, and pick whatever option works out the best for you. You can also scroll through YouTube here and find out maybe some other videos. I know I did a longer video on legs up the wall and variations on how you can relieve back pain that way. And I've done other various videos related to pain relief. So check them out in our Ed Talk playlist as well. We would be happy to answer any questions that you have if you reach out to us here at our clinic, and we'll guide you to the next best step, answer any questions, and help you feel better. So thank you so much for watching this Ed Talk. We will see you on the next one.